Hello, welcome to Writing Week and today's session, which is focusing on dentistry, optometry and veterinary science. So all week we have been running live sessions covering all 12 OET professions. You can see on the screen when those sessions were taking place this week. And today's session, as I mentioned, for dentists, optometrists and vets. Tomorrow we have a session for speech pathologists, physiotherapists and occupational therapists. If you've missed your session for this week, you'll be able to catch those videos on the official OET YouTube channel. And please do stay if you're here already, but you're not one of the professions I'm covering today, because we found that this has happened all during the week. We've had a variety of professions turning up each day, and there's definitely tips that I'm going to be sharing with you from today's session that you can easily apply to your profession. So stay tuned, see what's going on, and I'm sure you'll find something useful for you in today's session. The plan for today's session is to make it as interactive as possible. This means that I want to see your opinions. I want to read your comments as we go along. So please make use of the chat box on your social media channel. But I'm also going to ask you to regularly vote in some poll questions. We're going to have a practice with this feature now. If you have a second device handy, you might want to use that. Or if you're on your laptop or computer, open up a second tab so that you can quickly move between the live stream and the polling software, which is called menti.com. But we're going to try it out. So we're posting a link into the chat now, which is, have you written a letter for the new set of case notes? So click on that link. It will take you to a poll and you can let me know your answer to this question. It's a really easy one to answer. When you registered for this session, you would have received a set of case notes specific for your profession. Don't worry if you've turned up today having not registered. We will be sharing those case notes with you during the session as well, but I'm just interested to know from those of you here already, how many of you have used those case notes, you've practiced with writing a letter. Perhaps you're one of the people who submitted one of the letters in advance that I might be talking about today. So that's great. We can see from the poll on the screen that split between 60% saying yes at the moment, 40% saying no. That's absolutely fine. Remember, if you prefer, you can answer these questions in the chat as well on social media. So you can either answer directly in the poll from the link or in the chat. So we've got another question for you. This one is to find out when you are taking OET. So the link to answer this question is coming through in the chats now. I want you to type in the date of your OET test if you've already got it booked in. So let me know when you are planning to take OET, maybe October, November, December, or perhaps even into next year. So when are you planning to take OET? Type your answer using the link in the chat, or you can answer directly into chat if you prefer. Somebody's come through with 9th of September. I think that might be October. It's confusing, isn't it, with the month about to change. We've got someone else saying they're taking the test in November. That's great. Just give you 20 more seconds if you want to type in your answer to let me know when you are taking OET. Eva on chat is saying in October. Mohammed in chat is saying January. We've got another one for 9th of October coming through on the poll. So that's in just over a week, and that gives you some good time to learn from those tips that I'm going to be sharing with you today. We've also got someone else saying November. Rayanne is also, I think, saying November in the chat. All right, one last question to ask you. This question is what is your OET profession? So I've mentioned that today's session is specifically covering dentistry, optometry, and veterinary science, but you might not be one of those professions, and you're absolutely welcome to stay for the session today and learn some useful tips in any case. So type into the chat or using the link that we've put in chats what your profession is. And I can see we've got some nurses joining, but also some dentists. That's great. What is your OET profession? Got a pharmacist joining. A few more nurses saying they're here on chat. A doctor coming through on the poll. A doctor coming through on the chat as well. Just give you 20 more seconds if you want to answer the question, what is your OET profession? A couple more doctors joining on chat. That's great. All right, well, thank you for letting me know those answers. Now we're familiar with this software. Oh, great to see we have got a vet joining us today. That's fantastic. So we will be getting on to vet later on in the session. And now we're familiar with the software, let's get started with Writing Week. We're going to start off looking at some dentistry case notes, then we'll move on to optometry and finally veterinary science. So as I mentioned, if you are one of those professions, this is going to be particularly relevant for you. But if you're not one of those professions, if you are a doctor or a nurse or a pharmacist, you will find some useful tips from this session. So if you registered in advance for the session, as I mentioned, you will have received an advance copy of the case notes that we're looking at today. And we're going to look at those case notes together now and pick out the key information the reader needs you to communicate. So if you haven't had a chance to look at the case notes before, or this isn't your profession, you can now with us, and I'm going to give you some useful tips to learn how to select information from the case notes. So we're sharing the dentistry case notes into the chat now, so you can download your own copy. And I'm also going to show it on the screen here. And I'll zoom into some of the sections as we discuss them. If you're watching on YouTube, though, you might like to set the resolution of your video as high as possible to 720, turn it to landscape view to make it possible to see in a bit more detail. But as I said, I will zoom in to these sessions. So talking you through how you select information from the case notes. So the first thing that we need to do is to understand the basics of our role in the letter, which we can find in the notes section at the top. And we can see that for this scenario, we are a dentist writing about one of our regular patients who has a history of cancelling appointments. And the patient's details are just below the patient's name, Mr. Viktor Ivanov, and his date of birth. Now, next, we need to understand the reason for writing the letter. And it's a good idea to read the writing task a couple of times to make sure you fully understand it and have noticed all of the information your letter needs to communicate. So I want you to have a look at the writing task. It doesn't matter if you are not a dentist or you are a dentist. Have a look at the writing task now and answer this poll question, which is coming through in the chat. How many reasons for writing can you see in the writing task that I've zoomed into on the screen in front of you? Do you think there's 1, 2, or 3 different reasons for writing? Vote into the poll when you're ready, or you can let me know what you think the correct answer is in the chat. So how many reasons for writing can you see in this writing task for dentists? And I'll open up the poll now. How many reasons for writing can you see? 1, 2, 3, or 4 reasons for writing? So we've got somebody who said 2 on the poll, and Tatiana in the chat has also said 2. Just give you 10 more seconds in case anyone else is about to respond to the question as well. Yep, somebody else just voted in the poll. That's great. Vivienne suggesting 1 reason for writing in the chat. Mohammed saying 3 reasons for writing. Someone else saying M on YouTube is saying 2. Femi saying 1. So we've got a variety of answers coming through. On the poll, the conclusion is there's 2 reasons for writing. So let's have a look together. Yes, I would agree there are 2 reasons for writing, and these are to outline Mr. Ivanov's relevant history and to request further treatment. So those are our main reasons for writing, but it's also a good idea, this is a good principle for all of you, to check the last section of case notes, which is just above the writing task. Now, in this set of case notes, this is called plan. It's a good idea to see if there is any additional detail provided about the reason for writing. In these case notes, there isn't any additional detail. We know that we are writing to refer the patient to an endodontist. We saw that in the writing task itself. So there isn't any additional detail. But when we look at the optometry case notes after this, you'll notice that there is extra detail provided in that final section just above the writing task. So that's a good principle, a good tip for any profession to double check after you've read the writing task, is there any additional information you can find in the final section of case notes? Let's look back now at the treatment record for this patient. So we can see that the patient presented in January last year with pain in tooth 26 and agreed to have root canal therapy. This was conducted on 2 sessions, both in the same month, and then the patient was advised to return for core prep the next week ahead of crown placement in a month, but he cancelled both appointments. This brings us to the 15th of May, which I note is the same date as the one I've been given to write the letter. And the patient presents with pain in the same place. A draining buccal sinus is present, and a radiograph reveals a periapical abscess. So you as the dentist note that the crown wasn't placed as you had recommended, which has caused the cavity restoration to break down and leading to a possible reinfection of the canal system. So you advise the patient for the need of endodontic treatment for the tooth, and that a crown will be necessary after the treatment. Finally, let's look at the other section of case notes that we haven't looked at so far. And this time I want you to answer a question for me. Which of the notes that you can see on the screen right now, and we're popping the poll into the chat as well, which of these notes are relevant to the reader? Out of the headings, we've got social background, oral care, allergies, medical history, medications, and intraoral examination. So thinking about our reason for writing, the treatment record for this patient, what would you say are the reasons for writing? What are the irrelevant details? So you can choose from the poll, you can choose more than one answer option. Which of those headings would you say are irrelevant to the reader? So you can see on the screen in the poll, I've given you the headings to choose from. You can choose more than one of those. Do you think any of those headings from the notes are irrelevant to the reader? Vote in the poll, or you can let me know in the chat if you think any of those note headings are irrelevant to the reader. What do you think? Thinking about the fact that we are referring the patient to an endodontist because of the need to treat a tooth that has perhaps got a reinfected canal system. Which of these details would you say are irrelevant to the reader? So we've got a few suggestions coming through now. We've got a couple of responses saying the social background isn't relevant, the allergies aren't relevant, the medical history, the medications aren't relevant. Tatiana in the chat is saying all of them apart from the first are not relevant. Saji on the chat is saying the allergies aren't relevant. Looks very pretty. All of the answers coming through on the poll. We've got a variety of answers there. Most of you are suggesting that the social background is irrelevant. Great. So yes, I would agree with you. From these case notes, only the absent teeth are relevant to this reader because we've already picked up the patient's history of poor attendance from the notes at the start of the case history. That is definitely useful information for the reader. But we'd picked that up from the notes already. But the missing teeth are also going to be something that is useful for the reader as well. So in your 5 minutes of reading time that you get in OET prior to the 40 minutes you receive to write your letter, you need to work out the specifics of the situation and the information you need to communicate. And this table is a really helpful tool. It's helpful for all professions. And the headings that you can see on the left-hand side, I'm just going to take me off the screen to make it a little bit bigger for you to see. The headings that you can see on the left-hand side, you can learn to use to check the case notes for to make sure you don't leave out any important details. So while you're practicing, you could copy this table out onto a piece of paper and actually write in the case notes that relate to each heading, so that by test day you have these headings memorized and you can search for these details while reading. And then once the writing time starts, spend a couple of minutes underlining or highlighting the notes that you selected in your mind and roughly planning the structure of your letter. So we had a few dentistry letters submitted in advance of writing week, and we're going to use these to focus on the strengths and weaknesses against the writing assessment criteria, so you can understand what you need to do and avoid when writing your own letters. And the tips that I'm going to be providing about the assessment criteria will apply to all the professions. So as I keep saying, even if this isn't your profession, do stay tuned because you're going to learn some useful tips for your profession too. So here is the first letter, which was submitted by Ali. And I want you to take a couple of minutes to read it. If you haven't seen the case notes before today, try to put yourself in the reader's shoes and then let me know in the chat box to say if you feel well informed by the end of the letter or you're left with some questions. So do you think this letter gives you good coverage of the most important parts of the case notes, or you would be left with some questions at the end? So I'm just going to allow you a couple of minutes to read this letter. And then let me know in the chat on social media, either on Facebook or YouTube, whether you feel well informed by the end of the letter or you're left with some questions. So what do you think? I'll just give you another minute to let me know whether you feel this letter is a good response to the writing task, to the case notes. Samuel, in answer to your question, yes, this is going to be available on YouTube afterwards, so don't worry if you missed the beginning. Perhaps can we just pop the dentistry case notes into the chat again, please? I've got my colleague behind the scenes ready with the links. There we go. So if you're just joining, you haven't got the case notes for this situation, they're coming through on the chat now. All right, well, let's have a think about this letter. Do we think that this is a good response to the case notes or not? I'm going to ask you this question. Has the reason for writing been clearly explained at the start of the letter? And this is a poll question this time. So the poll question is coming through on the chat now. We're focusing specifically on the first paragraph and whether this has been made clearly and briefly explained at the start. There's a poll question you can choose from yes, partially, or no. So looking just at those first 3 lines of the letter that you can see on the screen now, if you were the reader, after reading that introduction, would you feel that you understand why you're receiving the letter from the beginning? So you can vote yes, partially, or no. So Berin is saying, I suppose the purpose is there. The letter explains the reason. However, there are too much details. Okay, thank you for that. We'll just see if anyone's going to vote in the poll as well. Click on the link that you can see in the chat if you want to vote. And we can see someone's come through with partially. They feel that the reason for writing has partially been explained. Someone else thinks yes. Give you 10 more seconds if you would like to answer. So we've got 2 people who are saying yes, 1 person saying no. That's gone up to 3 people saying yes. Great. All right, well, let's look at it together. So I would agree that the answer is yes. The reader knows straight away that the patient has trouble with tooth 26 and that endodontic treatment are necessary. And this is an important component for getting a good purpose score. However, and this is the second part of purpose, I didn't ask you to look at this part specifically. The second part of purpose is to expand on this reason for writing at the end of the letter. And what we can see at the end of this letter is some repetition of details in both locations. So the periapical abscess is mentioned twice, the reinfection of the canal system is mentioned twice, and further management is mentioned twice. And this is unnecessary doubling up for the reader. So my tip for purpose to get a good score for the purpose criteria is to start with the reason for writing the letter in a kind of high overall sense, and then end it with the specific requests that you have for the reader. So in this case, moving the second sentence that we can see in the introduction to the end of the letter would remove those repeated elements. All right, let's have another look at a part of this letter. So this time I want you to look at this sentence. There's a mistake in this sentence. We've got his pain was at tooth 26. I want you to let me know in this poll question, which is the correct preposition to complete this sentence. So his pain was blank tooth 26, which would be the correct preposition to complete that sentence. At, which you can see on the screen, is unfortunately incorrect. So either type into the chat or answer the poll, which has come into as a link on the screen, and let me know which preposition would be correct. So I'm looking for a single word. So M is saying in the chat on could be correct. Any other suggestions? How would we complete this sentence with one word? In has come through on the poll. And we've got on as well. Tatiana is saying in the chat. This is a really common mistake that we see a lot of candidates make with prepositions. Prepositions and articles, I would suggest, are one of the, or two of the most common grammar mistakes that students make. So don't feel bad if this is the mistake that you make. All right, 10 more seconds just to see if we get any other responses. Someone else has suggested in the poll. Mohammed saying in the chat as well. Okay, so the correct answer is in. Pain is thought of as an internal thing or within a body part. So the correct preposition is in. On is used for external things. So you might have a lump on your arm, for example, because we can see it externally. But pain is considered something internal, and so we use in this sentence. We do refer to pain as being on the left or on the right side. That's another little clarification. So if we're talking about the location of the pain, we would say on the left side, but that's because of the rule that goes with sides of the body rather than that being pain as such. So if you're talking about an organ or a body part, the pain is in that area. And that's the tip that I have for this question. So this is a language tip. Language is another of the assessment criteria. It's really important to learn common combinations of words for your profession. So learning that we would say pain in tooth 26 or advised to have is another common combination, which was a mistake in this letter, not advised for. And there's free software you can use, such as Grammarly, which can help you to check your writing for accuracy and then learn from the errors that are identified. So overall, there is a lot that is good about this letter in terms of language and clarity. Those little mistakes that I've picked out aren't really critical ones. The main thing this candidate needs to work on, though, is selection of details to include. A couple of you pointed out earlier in the chat that there's a lot of information included, and in fact, almost everything from the case notes has been included, which would make this letter feel quite exhausting for the reader to have to go through all of that information. Readers of healthcare letters appreciate something that's brief and without the unnecessary background. So let's look at a second dentistry letter. This one was submitted by Dro, And again, I'm going to give you a couple of minutes just to read through the letter and then comment in the chat about whether you think this letter successfully explains the reason for writing. So just have a couple of minutes to read this letter. Think about how it compares to the letter that you just saw from Ali, how it compares to the writing task, and then let me know whether you think it successfully explains the reason for writing to the reader. What do you think? Does this letter clearly explain why the endodontist is receiving the letter? Or would the reader feel some confusion? How successful do you find this letter in explaining the reason for writing? Just give you 30 more seconds. All right, so in my opinion, this letter is less successful in explaining the reason for writing. It's less successful in making the reason immediately apparent. So it's not enough to get the most important information included in the first paragraph. It really needs to be the first information you give about the patient. So in this letter, thank you for seeing Mr. Victor Ivanov, who requires a repeated root canal treatment of his upper left molar 26, should be the information that is first up for the reader. The other details about him cancelling appointments, being a regular patient, pain, are of secondary interest to the reader. So start with the details that the reader wants for the most. Looking at this section of paragraph 2, I want you to let me know as a poll question whether the background information to the patient's treatment in January is relevant to the reader. So you've got 3 options to choose from to answer this question. You can choose yes, no, or not sure. So looking at that part of the letter which I've highlighted on the screen, would you say that this background information to the patient's treatment in January is relevant to the reader based on the situation that we're writing about today? What are your thoughts? Is this relevant? In which case choose yes. Is it not relevant? In which case choose no. Or you're not sure. How would you answer this question? Let's have a look. Some answers coming through. What do you think? Is the background information to the patient's treatment in January relevant to the reader? Yes, no, or not sure. Okay, we've got somebody coming through saying no. M on YouTube saying yes. So that's 50-50 at the moment. Have we got a deciding vote from somebody? Which way are we going to go? Yes or no? Or not sure? All right, I will be the adjudicator. So this information we can see from the case notes, and we can remember that the patient now has a pressing concern of a periapical abscess, which makes it the reader's main concern too. So they need to know the facts of the previous treatment, but not all of the details, such as the treatment choices that were offered, the exact treatment process, and so forth. So my tip for this question, and this one relates to conciseness and clarity. When reporting previous treatment appointments, consider which details have been superseded by the current situation and omit anything that is now not relevant. All right, one more question about this letter. We're looking now at the final sentence of the letter, which is, please note he has an unremarkable medical history. So this sentence is all by itself. It's something that we don't particularly recommend. And so my question to you as a poll question is, if you had written this letter, where would you have included this final sentence? So this sentence, please note he has an unremarkable medical history. My suggestion is that you could have included it within one of the other paragraphs. So we've got 4 other paragraphs to choose from. Where do you think would be the best location for this sentence to avoid it ending up by itself on its own at the end of the letter? Because remember, the final sentence is the last thing that the reader has in their mind as they put your letter down. So you want to finish with something significant at the end of your letter. This sentence, I would suggest, could go somewhere else to be better communicated. So 4 options to choose from in the poll, or let me know in the chat. Do you think you would put it in paragraph 1, 2, 3, or 4? So we've got a couple of votes for paragraph 3, a couple, 1 each for 2, 3, and 4. And on chat, we've got paragraph 1. So we've got full house votes for each of the options. A few more have suggested paragraph 4 on the poll. You would have included it within that paragraph. So I would say that there's definitely more than one option about where this information could be included. Perhaps it could have gone in paragraph 1, replacing the history of poor hygiene, which isn't mentioned in the case notes. Or it could be in the final paragraph, which I know was a lot of your suggestions, removing the sentence about radiographs and records being included, which wasn't something specified as one of the tasks for you to do. So you can omit that sentence, and perhaps you could have put that single sentence about the unremarkable history in its place. So a tip this time for organization and layout: try to avoid adding details by themselves at the end of the letter. If you think of something you want to add once you've written everything else, you can edit your letter using arrows if you're writing on paper, or by typing it into the place where you need it to go. And that's the better way than ending up with a sentence all by itself. So overall, the writing in this letter is also very clear, with few mistakes, but this candidate should focus on summarizing the history of the situation more succinctly, so avoiding that unnecessary background detail, and making sure that the introduction gets straight to the point for the reader. So I'm going to show you one more letter. This one was submitted by Lou, and I'm going to pick out a few details from this one to consider together. So this letter has similar strengths and weaknesses to the other. It also includes a lot of the background to the initial root canal treatment, which could have been shortened and summarized more effectively, but this introduction is clear enough. So remember, my tip from this letter is that it's appropriate language for a healthcare letter to use the patient's name. And the first time you mention them in each paragraph, like Lou has done, in fact, we use the full name in the introduction, and then the patient's title and family name in the second and subsequent paragraphs, but avoid referring to them as the patient or this case. These terms aren't seen to be particularly polite. And so for genre and style, the first two options using the patient's name are much more appropriate than the patient that we can see in paragraph 3. So if you are a dentist watching today, please add your opinions to the final poll question for you before we move on to optometry. So I'd like to know if, as a dentist, you feel you've learned some useful tips to improve your writing from looking at these samples. So you can let me know yes, no, or not sure. And while you're answering that poll question, we're also going to share into the chat now the official sample letter for these case notes. So if you have written your letter and you want to compare your letter to the official sample letter, you can check that out from the chat now. And just to give you advance knowledge that next week, all of these case notes for all of the OET professions will be available from the OET website with the sample answers with them as well. All right, we're going to move on now to optometry. So if you are an optometrist, you've been patiently waiting for your turn in the spotlight, please let me know in the comments box, say hi, and we'll know that you are an optometrist joining for today's session. We hope we have a couple here. But if you haven't yet seen the new case notes for optometry, you can download them from the link that we're posting into chat now. These are the optometry case notes. If you're not an optometrist, you're welcome to look at these case notes. We're going to go through them together. And again, I'll demonstrate how to select what to include from these case notes. So with any set of case notes, you need to start at the beginning to work out the role in the situation. And we can see here that the notes tell us that your patient has presented for a routine eye assessment, and we have the patient's name and date of birth presented below. Then the place that we need to go to is the writing task, which is at the other end of the case notes. And we need to work out how many reasons for writing we can find in the writing task. Now, we did have this set as a poll question, but given that it doesn't appear that we've got any optometrists joining us today, I think I will just provide the correct answer here, which is 2. So we can see that these case notes are requesting further investigation and management. So for context, you'll also need to outline the patient's history and treatment so far, but this itself isn't a reason for writing. And as I mentioned before, to understand the task more, it's always a good idea to check the final section of case notes, which are provided just above the writing task. And plan is this section. And here we can find quite a few extra and helpful details about the investigations we are requesting. So we can see that we need to confirm the diagnosis and urgent cardiovascular workup. And this links directly to the writing task. So it's a really good tip to check those two things together for the information that they provide. So working through the case notes, the majority of the case notes are taken up with the visit on the 15th of May, which I note is the same date as the one I've been given to write the letter. And the assessment details show that the patient complained of recent episodes of loss of vision in the left eye, and the results of the investigation detail where the abnormalities lie and that they are potentially linked to hypertension. You diagnose atherothromboembolism, which is causing retinal transient ischemic attacks, and that this is likely from narrowing or blockage of the left carotid. So from the final sections of case notes, we can see a few details are important to include in our letter, but also a few details, particularly from the social background, which could be omitted. So things like the father dying of a cardiac event, the fact that the patient has hypertension and hyperlipidemia. These things are all important to include, as are that the patient is wearing prescription contact lenses, but the other details, the social background, are not important. So here is a table of those most important information from the case notes, which help to make writing the letter easier. As I explained earlier, this table is really useful for making sure you identify the details that are going to be important to include for the reader. If you try using this table, you may sometimes find that you add a few more details to it than when you come to write the letter you end up using. That's absolutely fine. It's part of the process of learning how to summarize the key details for the reader and remembering that what you find important may not be as important to the reader. So I had one optometry letter, which was submitted by Fatima, and thank you very much for doing that. So here it is, and I'll give you a minute to read it. And then if you'd like to, if you're following along with me, please comment into the chat box whether you think it is a strong or weak letter to explain the situation. And I will let you know my thoughts on it just after I've given you a minute's chance to read through the letter. So remembering our reason for writing is to refer this patient who you suspect of having an atherothromboembolism. How successful do you think this letter is? Is it a strong or weak letter? All right, hopefully that's given you enough time just to quickly skim over the notes. So in terms of whether this is a strong or a weak response, I would agree this is generally a strong response to the situation. And by the end of the letter, the reader would be well informed of what was currently happening. But there is a little bit of unnecessary repetition in the first and last paragraphs, which could be avoided by omitting the second time in the final paragraph. So I'm going to ask you to consider, I'm not going to ask you to vote on this. I'm going to just give you a minute to think about it, and then I'm going to let you know the answer. I'm going to ask you to think about when you would want to find out the letter is urgent. So looking at this letter, when would you consider it was important to know if this was urgent or not? Just give you a few seconds to think about that. And then I will tell you that I would say that the urgency needs to be in the introduction and ideally in the very first words. We can see that the urgency in this letter isn't mentioned until almost the last words of the letter. And I don't know about you, but if you've ever had to read an urgent letter or email from a colleague, you know as soon as you see the words urgent or emergency, you focus in greater detail on understanding what has made this urgent and what you will be required to do. So until those words are found, you're not allowing the reader to do this. So my tip here, which is for both purpose and content, is if the case notes include the words urgent or emergency, include this at the very start of your letter so that you're giving the reader that chance to understand that this is something that they need to understand straight away. They need to read it straight away, in fact, and that they're going to be required to take some action. Now, a few other details from the case notes that we thought about earlier that have been omitted from these from this letter, that the patient's father died of a cardiac event at 63, and they haven't included any of the specifics of the abnormalities in both eyes. So I'd hope you'd agree that all of these details that you can see on the screen are pretty important to the reader and missing from this letter. Another tip for content is that the table I've shown you at the start of the optometry section is a really helpful tool in summarizing all the details which need to go into the letter and help you to avoid missing anything important. Overall, the letter is well written with appropriate language, but there are some slips, such as this sentence about the patient's medical history. So known case should be avoided. Instead, Ms. Mendora has hypertension is suitable. And we would write taking rather than under for medication. And there's also a slip in the closing language. The S from yours in front of sincerely has been missed off. Let's compare it to the official sample letter for the case notes, and we're sharing the link to those sample letters, in the chat now, if you are an optometrist watching the session a little bit later. So the writer has used a higher number of short paragraphs to clearly organize the information in a way which is clear for the reader. Remember, there isn't a maximum or minimum number of paragraphs you can include in your letter. You decide what will be clearest for the reader. And despite including more details, the number of words is actually lower than the one submitted by Fatima, and this has been achieved by avoiding repetition. All right, so we're going to move on to our final profession for today. Now, earlier on in the session, we did have someone say they were a vet. So if the vet is still here, let us know by saying hi in the chat box. It would be great to know that we have a vet joining today. I didn't actually get any vet letters submitted. However, I'm going to spend a little bit of time talking through the vet science case notes, which we're sharing into the chats now. And so if you are a vet and you're watching later, you'll still be able to participate with what's going on the screen using your own set of the case notes that are available. So we can see from this set of case notes that Wanda, the poodle, has diabetes, and the vet is providing written instructions following a consultation with the poodle's owners to make sure care instructions are followed, as well as the warning signs to look out for. So looking at the case notes specifically, we can see that we are writing as a vet at a local clinic to the O'Connor family, and we are providing them with instructions, specific instructions for the care of their pets that they need to follow and keep in a central location. Looking back at yesterday's examination record, I'm just going to give Eva a shout out. She said she is joining as a vet, so it's lovely to have you here, Eva. Looking back at yesterday's examination record, we find that Wanda has diabetes mellitus, and the details of the treatment plan include urine testing, diet, and giving an insulin dose at the same time each day. The instruction section on the right-hand side contains some action points for the family if they notice any of the given warning signs. And the final section of the case notes, the past history that you can see at the top of the screen now, it doesn't contain any further relevant details the family wouldn't already be familiar with. So we don't need to consider that section of the case notes at all. So on the screen is a table of those case notes, which have been reduced to their main points. And as I've mentioned, if you are a vet getting ready for the test, or you're any other profession, those headings that you can see down the left-hand side are a really useful thing to memorize, so that when you're looking at any set of case notes, you can look specifically within the different sections to find the information that fit with each of those headings. And it helps you to correctly identify the information to include, as well as the information to omit. So let's look at how the sample letter for this set of vet case notes communicate the information. So we can see that the letter has been organized into 5 clear sections. They cover introduction, sugar levels, diet or insulin, warning signs, and future plans. And the introduction explains the reason for writing, provide instructions for the family, and the letter expands on this in the different sections. Now, the importance of these clear paragraphs is quite significant for organization and layout. It's a tip that I can give you, that each paragraph should in fact sort of have a title, like you can see on the left-hand side. If you've done a good job with your paragraph, you should be able to say, paragraph 3 covers diet and insulin. Paragraph 4 covers warning signs, for example. There should only be one topic, one theme per paragraph. And that's a really good way of checking that when you've written your letter, is to look again at the paragraph and decide, what is the title? If I was to give this a title, what is the title for this paragraph? So in this sample answer, not all of the detail from the treatment plan notes have been included, as would be expected, given that this letter is being provided following a physical consultation with the vet. Organising the information in order of the timing of different instructions and what to do if this can't be done help make it clear for a lay audience, because remember, we're writing to a family here, we're not writing to a healthcare professional. So we can see that the paragraphs move through the timing of the day. We start with 12 o'clock, which is when the urine testing should happen. Then we've got diet at 1:30 and insulin at 2. So that is clearly organized for the reader. And the warning signs in the final paragraph are also dealt with unemotively but clearly. So there's very objective language that has been used. It's just very factual information. Contact me immediately if there's no improvement, to try and prevent any sort of panic setting in the family. And finally, the past history, which would be known by the owners receiving the letter and not relevant to the current situation, has been omitted. So that's just a summary on the screen of the things that this letter does well, and you can use as guidance when you write your own letter. And that brings us to the end of today's session. So as I've mentioned, all the case notes and official sample letters for the tasks are going to be available for all OET professions on the OET website next week. In the meantime, if you are looking for more writing resources from OET, then please download the OET writing guide, which is coming through into the chat now. This contains lots of information about the different assessment criteria that I've talked through today. And we're also adding a link to the other thing that you can see on the screen now, which is the assessment criteria. You'll notice that all of the tips that I provided during the session were linked to one or other of those assessment criteria. and having a copy of those yourself can make sure you're really evidencing the things that the assessors can score you highly for. If you hadn't already tried writing a letter for these case notes, have a go before you look at the sample letter that we've provided today, and consider making use of the table I've been using to help you correctly select the details you need to include, as well as decide which details to omit. So thank you very much for your participation and joining. We will see you again soon and look forward to more sessions coming up in the future. Do subscribe to our official OET YouTube channel if you want to get more of these types of videos. Thank you very much. We'll see you soon.